Have you ever wondered why your insurance will pay for your MRI, your surgery, your medications, but then tells you that hearing aids aren't covered? Well, there's actually a pretty interesting history behind that. When Medicare was created in the 1960s, hearing aids were specifically excluded from Medicare coverage. And here's the important part. This isn't because hearing aids aren't medical devices. Medicare law actually contains a statutory exclusion for hearing aids. So even today, original Medicare generally doesn't cover the cost of conventional hearing aids. And because Medicare is such a major player in American healthcare, its coverage policies have had a huge influence on the insurance system. That means millions of Americans can end up in this really strange situation. Your hearing loss is a medical condition, your audiologist is a licensed healthcare professional, your hearing aids are medical devices prescribed to treat your hearing loss, but the device itself may not be covered. So changing this isn't as simple as saying Medicare should just cover hearing aids. Medicare is a massive program with a finite budget. If Congress adds a new covered benefit, somebody has to figure out how to pay for it. And that creates a much bigger political and healthcare policy debate about Medicare spending, reimbursement, and which services get prioritized. Now, there's been a lot of advocacy to change this. Audiologists, patients, professional organizations, and hearing loss advocates have been pushing for better access to hearing healthcare for years. And some Medicare Advantage plans already offer hearing benefits, but those benefits can vary dramatically from plan to plan. So when a patient asks me, why doesn't my insurance cover my hearing aids? The answer isn't because hearing loss isn't medical. It's much more complicated than that. It's a policy decision that dates back decades, and changing it requires changing the law. And honestly, I think that's a conversation we need to keep having.